Hi, I'm Dr. Todd Shackett, and good morning and welcome to this Monday Morning Minute. For the next 3 weeks, we're going to be highlighting case studies that have been prepared by our 3 dental residents in our NYU Langone AEGD program. They have all placed over 50 mini dental implants since starting the program in July. It is my pleasure to introduce Dr. Dillon Caines as our first program this week. Good morning, Dillon.
Yeah, good morning, Dr. Shackett. Thanks for having me on.
Great to have you on the program, and great to have you as one of our amazing residents this year.
Thank you. No, thank you for the opportunity. It's been amazing.
What will your case focus on today?
So this case was a young individual who came in with a few missing teeth, and it was a great application for our mono dental implants. We use a lot of minis here for our denture stabilizations, our roundhouses, but those mono implants, they're great for immediate extractions and also just really nice in that maxillary premolar to premolar zone.
So what teeth did you do in the case?
So in this case, we did number 12 and 13.
Okay, perfect.
It was a nice 12 and 13 premolar case. Patient was very happy with the results. It was a nice, efficient process, and yeah, we got some good results there.
So in general, Dillon, what do you think of this program here in Buffalo?
I think this program's the greatest program in the country. When I discovered it and started reading about it in D2 everything you're doing up here, it seemed to be revolutionary. And since I've been here, it's been way beyond that in every way.
You started looking into our program when you were in your second year of dental school?
Well, yeah, because once I started reading about the minis and what you were doing, shortly thereafter I heard that you were starting a residency, and last year's class was the first inaugural class, and it's been incredible.
I didn't even know you did that. One thing I do remember about you, Dillon, when I interviewed you, which stuck in my head, was the fact that you went to NYU Dental School and you shared a tiny apartment with an entire family.
Yes, yeah. It was a family of 5 down in Chinatown there, and they moved to the States, to pursue the American dream. And I'm from Canada, and I was doing the same thing. So, we meshed together, and it was a really good experience.
Well, we all know how expensive it is to live in New York, so you were on a college dental school budget, and you rented one small room that had a curtain between you and the parents of the family, which had to be very unique and interesting.
It was, yeah. They actually didn't, speak English, and so there was a lot of cultural learning and cultural exchanges, and it was great, yeah.
Well, you got a little more space in your apartment here in Buffalo, right?
Oh yeah, no, Buffalo's the best, and if you're interested in the residency, definitely it's life-changing, so it's career-changing, so definitely look into it.
Well, I'll be honest with you, that was one of the things that really stood out when Mr. Spilecki and I interviewed you and made us decide we wanted this guy in our program. So
great, yeah.
We're really happy to have you here,
Thank
Dillon.
you so much.
You're doing a great job.
Yeah, appreciate
actually,
it.
I know you've placed more than 50 minis, probably close to 100.
Yeah, we're about the 120 mark now.
120?
Yeah, that was, back in October, we were at about 50, and so now it's just ramped up, and we're increasing in 2022.
And how many teeth do you think you've extracted?
At least 400.
400 teeth.
At least, yeah.
And you've only been here for what, 5 months?
Yeah, we're doing a lot of full mouth cases, so you end up doing 20 teeth in a case.
Unbelievable.
So it's been great. Thank you.
That's fantastic. Well, we're glad to have you here with the program, and I'm really excited for you to share this study that you did for that patient.
Sounds good. Yeah.
Thanks, Dillon.
Great.
And we'll see you next week on the Monday Morning Minute.
All right. So today I just wanted to talk about the monos. The minis are just incredible for so many applications, but the mono is this one piece of our toolkit that really rounds out what we do. It's great for fixed applications. You can see here just a quick review of it. Has that nice clinical abutment head and that bendable collar. And it has a lot of similarities to the mini. It's self-tapping. It's a one piece and flapless surgical placement. Really excels in the premolar to premolar region in the maxillary. It can also be used in the mandibular posterior as well. Really great for immediate placements due to the unique thread design. This is the advanced course, so I'm sure you guys know this really well, but some treatment planning considerations with the mono is that 4 millimeter collar here, that polished collar has to be considered when you're treatment planning, when you're doing your measurements. My patient today was a 45-year-old female, a very classic patient. She came in with some pain in the lower right, had a few missing teeth, and she wanted to replace them. She had a history of some extractions and a few composites. Her oral hygiene was quite good overall. Her medical history, she had a benign breast tumor removed in 2001, but other than that, she was quite healthy, a few allergies. Her extraoral and intraoral exams really revealed no substantial, issues. So she presented just like this, again, pain in the lower right, the edentulous region up here in 12 and 13 rather, that she really wanted to address. Overall, with her periocharting and periodontal diagnosis, she had chronic generalized gingivitis, a bit of calculus, and heavy plaque. Overall, we did our endodontic diagnostics on 28. We found it to be irreversible pulpitis. Other than that, we had number 19 and 28 and 29 were quite broken down. So our overall treatment plan that we came up with was some monos in 12 and 13, crowns at 19 and 29, and a mono at 28. This was the treatment plan she ended up going with. Alternatives were, root canals for number 28. She really didn't want to do any root canals. She wanted to avoid that at all costs, just the history of, that she's heard from her family members. Traditional bridges were an option, but, the patient agreed that cutting down the adjacent teeth wasn't ideal. And she didn't want anything removable, so fixed was the way to go. This is just some CT planning for sites 12 and 13. So you can see we're just measuring, our palatal bone, getting our length. In this case, we chose the 3.0 by 11 monos at 12 and 13. Our clinical rationale is that we had the bendable prosthetic head. We had that increased clinical crown height of that abutment, which is nice, and we had plenty of bone to work with. This was from surgery day. We did the placement of 12 and 13, marked our sites, placed them. This is just some analytics of the placement after the procedure. So this was number 12. And one of the greatest learning experiences here has been really looking at the implants after you place them on the CT and seeing how you did versus what it looked like in the mouth. So here it was, number 12 was a bit buccal, not as ideal, but it torqued at 60 newtons, and so that was great. In the case of number 13, that was a bit better. It was nice and centered, what we're looking for, so that was good. This is an image of the final impression visit, so everything healed up really well, really nice to percussion. This was from crown delivery day, so we had really nice PFZ crowns, number 12 and 13. This is what the final delivery looked like. Patient was very happy with the result. He was feeling really good. And these videos here, they're not working, but I was just showing you the percussion tests at the 1 month follow-up. Due to finances, we had to wait a little bit longer to do the lower right. Ever since we've done the lower right, we delivered her other crowns, and she's doing great. We're just waiting on this crown's coming back in about a week, and we'll cement that, and everything's looking really good. So yeah, thank you very much. Appreciate it.
Take advantage of our Black Friday end of the year specials. Buy 100 MDL, Milo, or mono implants and get 20 free, plus 2 supply kits. Buy 75 MDL, Milo, or mono implants, get 15 free, and 1 supply kit. The supply kit includes 1 10-pack of Shack & First mono healing caps, 1 10-pack of O-ball healing caps, 1 10-pack of Shack & First impression copings, and 1 10-pack of Shack & First blockout shims, as well as 1 tube of Shack & First resin cement, all for free. Buy 50 MDL, Milo, or mono implants, and we'll give you 10 implants free and 5 drills free. And don't forget about our buy 3, get 1 free specials. Buy 3 10-packs of TrueLock abutments or TrueLock O-caps and get 1 10-pack for free. Buy 3 10-packs of standard, strong, or extra strong O-rings and get 1 10-pack for free. Buy 3 tubes of Shack & First resin cement or reline material and get 1 free. Buy 3 boxes of Osteogen, either strips or plugs, and get 1 free. And don't forget to take advantage of the $179 tax deduction before the end of the year on Generate 3D Cone Beam, the Piezotome Cube, the LPRF Intraspin machine, or buy the AEU 7000 surgical motor, which everyone needs, and the powered trolley, and get 2 Shack & First patient education models of your choice free. Call Shack & First today at 1-888-4-SHACKN and don't miss out on our most aggressive deals of the year.